All right, I will call this meeting of the Parkview Health Center Committee to order. Our next order of business is approval of the September 21st, 2023 meeting minutes.
I'd like to make a motion. We, with an amendment, but motion to approve the September 21st, 2023 committee minutes. And we're going to change the date on the approval to September 19th. No, I'm sorry.
From September 19th.
Wait, the minutes was written with the 19th on it. We're changing it to the 21st on the minutes. Okay.
Okay, perfect. Second.
Is there some second? Is there someone new compiling these minutes because they're quite thorough?
Me.
Okay. Did you? Yeah, I mean, did you have to sit through this meeting again, watching us?
I did go back.
Yeah,
Yes,
that's
I watched
a lot
the
of work.
video.
It's extra work.
Mhm.
Good. Good.
Right, anything else? Okay, all in favor of approving the minutes as corrected, say aye. Aye. All opposed? Carries. Okay, item 3, public forum. Nobody on the Zoom, nobody here wants to speak. Okay, all right. We'll go on to our financial report.
Okay, so you have the September income statements in the packet. Going through revenues. Our Medicare number is still trending higher than what we projected. And that's because we're getting about 30% higher reimbursement rate from the Fed on that. In the state. And just the other ones, the Title 18 in the Med Advance room and board are down from our budget, and that's mainly due to the census in those areas. Private pay fee is running good. We're down from our budgeted number, but we're a little bit ahead of last year. And the operating grant number, that's our SP money, and that's trending higher than what we had budgeted. Still, and even higher than last year, so. They did make an adjustment to the 23-24 rate, reduced it by $100,000, but it still will give us a decent income there. So our percentage should be about 75%. Our revenues are running at, if you look at the total revenue line, we're almost at 73%. So about on track of where we should be. In labor, we're at 56% of budget, and even down a little bit from last year. So travel, we're still waiting. I know I just did a couple pro card bills, so we have some more stuff coming through for that for it's the 1st of October that the actual convention hit. So and then there's a couple more conventions that are coming up in November and December, so we'll still be using some of those funds yet. Capital outlay,
You're 60%, 60%, 100%.
yep,
That's a lot of travel.
that's a lot of travel with that. And then for the capital outlay, we had. The only thing we're kind of waiting for now. The improvements were, that 28,000 that's sitting there. That's for our screened-in porch. And we still haven't found anybody that's willing to. Give us a pricing on doing that.
What was that? The
The
improvements?
improvements. Yeah.
Okay,
The equipment, thing that we're waiting for is the, van to come through. And it's somewhere around, $60,000 there. In the equipment. In the next category, we're sitting okay there. The one that's kind of high is computer software. And I looked at that one, there's actually a charge for computation software. And it actually got miscoded into there, it actually should be in our data processing fee, so that's gonna be moved this next month. Next category is our operating, that's running about 50% of our budget. Nothing too crazy in there. Everything is looking good in that area. Repairs and maintenance. We're at 77%. The one that's a little hot, or that's high, is the other electrical. There was a $3,200 exit light project that we had to replace. We replaced the regular bulbs with LED bulbs, so that was a $3,200 project in there. And then down towards the bottom, the equipment repairs. There's $14,000 of kitchen cooler repairs in there. That makes that one a little bit higher, but other than that, everything else is trending pretty close to normal. Utilities are at about 70%. We're gonna be pretty close on that one as we get towards the end of the year and a little bit more heat and stuff, but I think we should be overall in that category, still should be pretty good. The next, the contractual services, our medical and dental is higher than we budgeted. And that's mainly due to employee physicals and the drug testing. And we've switched that now to doing the drug testing in-house, so that should save us quite a bit of money there. Building repairs, that one, we're still kind of waiting for facilities to give us the RFP on the caulking project, so that's.
Which one is it?
That's the building repair line. 5508.
Yeah.
Yeah, there's a
Caulking, I don't remember hearing about that.
that's they're redoing the footing of the caulking. It's been, I think that was in the 5-year plan last year.
Oh, could be on the list that we just don't talk about.
Yeah,
yeah.
yeah. Last year, they talked about doing it, and we put it in the budget this last year as a, I think an add-on, I believe.
I don't know, with some pest control.
Yeah. So,
Yeah.
Keep the rats out.
not so much a rat, but ants. hopefully.
Ants and.
Bird
Centipedes.
feeder rodents.
Ants and their
Crawling and
Any-
stuff, yeah.
Anything that's eating fallen bird
So-
feed.
Just kidding.
Yeah. And professional services line, that's our contracted staff running at 70%. So we Still have quite a bit of room left in there for the next 3 months. So, should be okay there. And so if you go down towards the bottom, there's the total expenses before the ARPA transfer of 11,524,000. Our revenues are at 12,491,000. So we're sitting with an actual positive amount of 966,736. When we had applied 2,296,000 of our, in our budget, of our fund balance, and through the 9 months, we would have applied 1,792,000, so we're actually 2,689,000 ahead of where we're planning to be at this point.
Yeah. Doug, just to specify, meaning the priority, what we would touch last would be the use of the fund balance.
Yes.
So the levy that we put in, we would use that first before the hope is to not touch the fund balance. To leave that there, correct?
Yep.
Right. Yeah.
You talking about the contingency?
No, the Parkview fund balance. So we budgeted just in case we need it for the year. And last year was 1.9 something million, right? Is that we thought that we may need to get to. And again, the Medicaid reimbursement has been helpful. The new formula of how the state has been helping out has been helpful. So even though it was budgeted, we're hoping to not have to touch that. The 1.9 that we budgeted for fund balance from last year.
So are you? When we get to a point of amending their budget, you amend that out and that into the.
No,
No, it'll stay right in their balance because they're enterprise fund. So the million, and Doug, is it fair to say that the million of tax levy that we 900 some thousand that we put in last year, right? That should be used this year?
well. Right now, you're running about 214,000 ahead of what we've actually, so far, we've taken or transferred 752,000 of fund balance, of tax levy.
Of tax levy.
We're at a profit of 966,000, so we're actually doing better than our tax levy by 214,000.
Right.
So right now, we're not going to
Well,
use any fund balance.
correct. Technically, it's still using 700 some thousand of levy.
Yeah.
But with that, and I think I'm okay, and I hope the board would be okay that we can say. We could stick $1 million into this asset to keep it running. That would be hopefully the thought of this room and the thought of the county board.
So. In essence, about about zero taken out of the fund balance.
Yeah.
And about 700,000, give or take, we'll see where it ends up, of levy instead of what we have budgeted for, closer to $1 million.
Right.
So that feels pretty good, especially when for the last 10 months of administrators' reports, we've talked about a census that hasn't been where we had budgeted for, so which we knew was gonna be difficult to get, so that all feels great. I don't have any questions, but feel free if anybody does, go ahead.
Well, a unique position, I can't remember, or I don't know if it ever happened where the Medicaid was almost more payment than the private pay, right?
Yeah.
No,
Right.
never.
So that is a welcome change.
Okay, if there's no other questions on the financial report, we can go on to the administrative report.
All right, sounds good. So daily census for September was 95. Average occupancy rate was about 56%. We had 8 admissions, 12 discharges. 3 of those were that passed at Parkfield, and 9 discharged back into the community. Current number of people on our waiting list is 26. On average, between private pay and veterans, we've got 22% of our population is that peer source. 67% are medical assistants or Medicaid, 4% are family care, which is like a managed Medicaid community program. 4% Med Advantage or insurance, and 1% Medicare. Next month, our census will probably drop a little bit for October. We did hold admissions due to a recent respiratory outbreak on our long-term or our short-term care neighborhood. So we did hold admissions. We're no longer holding admissions right now. We had to wait for tests to come back. It came back as common cold, so we're good to go, but for safe precautions. In that neighborhood that we moved, we also brought, they were on the 2nd floor. We just brought them all down yesterday to the 1st floor. So all of the residents were moved from the 2nd to the 1st floor yesterday. So went very smooth. Everybody was very grateful.
A couple questions.
Yeah.
On the 9 discharges, are those basically people that come for like, say, short term, like 30 days or something like that, and then they go home?
Mhm.
Is that
Yeah.
what the most of that makeup is?
Correct.
Okay.
Yeah.
And then, other nursing homes. I'm thinking, and I'll just say other rather than specific. When you have an outbreak like that, is not really competitor, but something else.
Well, competitor.
Okay, competitor.
Sure.
Are they doing the same thing?
Mm-hmm.
Okay,
They should
so
be.
we're all under the same.
We should all be following the same infection control guidelines and practices. So we held admissions because of the particular neighborhood. Now, we could have taken admissions on, if we had open rooms on long-term care units, we could go there, but
Okay.
just not to that neighborhood.
But I'm thinking that maybe there's 1 or 2 nursing homes that aren't following that.
Really?
Yeah. You wouldn't want to go there anyway, but that's. That answers my question.
Okay.
Thank you.
Sure. Alrighty, for staffing for September, our current staff, the beginning of September, we had 171 staff. We hired 7 people in the month of September. Retention rate was 98%, which means we had a turnover rate of 2%. We had 3 resignations and 1 termination. Current open positions we have for RNs and LPNs is 16, 53 CNAs, 10.5 hospitality aides. Nothing in housekeeping that is full, and then food service, we've got 2.3 positions that are open. We do have, oh, well, I know it's on the agenda somewhere here, but we do have a new CNA training program that's going to be starting, a new class, I should say, that's starting November 1st, and there's about 6 people in that class there, so. As far as incentives go, they remain the same, same from last year, right around this time, so nothing too significant as far as changes goes with incentives.
CNAs, are they young, old, middle age? Have you got some young?
Varied.
Varied, that's good.
Mhm.
Okay. Were any of them CNA certified before, or are these all newbies?
In the class or
Yeah.
newbies, yeah, and those are mostly young kids.
Okay.
Yeah, most of them are going to school for the nursing program and part
Okay.
of the nursing program.
But
they
that
have
works
too.
It all
Yeah.
works. It works great. So when you say you're starting a class, is it What's the length?
3 weeks.
Okay,
Mhm.
very good. Thank you.
3 weeks, and sometimes it's, I shouldn't say they're always 3 weeks, sometimes it's based off of schedules with the class, so. If we know that we have a bunch of college kids, we
Mhm.
might run that, so it's just on weekends.
Okay.
They've done that too, so they'll
That's
do
good.
maybe like a Friday night, Saturday, and then maybe half day Sunday. Depending on when we can get all the students in together too, so.
Very flexible.
Yes, we're very lucky that Megan Shea, our instructor, has a flexible schedule that she's able to accommodate that.
Great.
Are we gonna be talking about the impact of the PTO, pending PTO changes on incentivizing increase in staff? Are you gonna talk about that, or? Can we have time? I just wanted to ask you.
I don't know if is it agenda?
No,
I
no, I don't,
I
but
think it's maybe, what I'd say is like,
But-
you know, in the realm of like staffing,
Yeah,
you know, you can ask that
so
question.
so that's where we are, right?
In the realm of if it's in the budget, if we want to talk about the PTO plan more specific to Parkview, I think we should put it on the agenda next month.
Okay.
Have a more robust conversation.
yeah, I can do that.
Okay.
And we're still taking a look at things, so the extra time would be nice, we're. Trying to. Have a plan that fits everything, it sounds great, and I think there's some tweaks that have to happen on some of the 24/7 departments.
Would it be, unusual to have Mark Emick show up at the meeting?
Yeah, let's do this. I think it's clear that we want to have a more detailed conversation. I think we want that, so I think, I'll say this to you two, and you two can decide, you know, who's appropriate to be here in the future. You know, given that it is a 24/7 department, given that there's extra considerations around holidays that are somewhat unique to this department. I think that captures probably all of, you know, obviously like the license nature, things like that, like what, you know, I think we'd probably like to have a conversation specific to how the PTO.
Yeah, just what comes to mind is that conversation, if I may, just briefly, that example that was given in the presentation where she was on the phone negotiating with potential, I think it was a truck repair professional or something like that?
Mechanic.
And, you know, she mentioned 25-day first year benefit, and he gasped, right?
Yeah.
And he said,
It's start tomorrow.
so just, you know, from my own being out there on the street, I already heard some positive feedback, just mentioning that in passing. Of the, you know, people in the healthcare field that thought that was good.
Well,
Okay.
Marcus already presented to you over here, but he made a separate presentation to Parkview, did he not? Lindsay? Mark Emick.
He made a presentation with staff. I spoke to him individually before. Because there was going to be. An impact to Parkview.
So,
Okay, that's all I wanted.
So I think he just wanted to touch base with me prior to it going to staff.
so if he were to come here to our committee or whatever, then get back to one blind, sort of.
Yeah, I think I'll let.
I've added it onto
like,
the
work with
suggested
this group,
topics.
Yeah,
Yeah,
and wherever it is, and you know, wherever it is, if it's ready for.
Yep.
Somebody from administration to come in and give us real details, or if you're, you know, busy one way or the other next month. We'll dive into that with whatever degree.
I'll probably send the team of all three of them, they've been working on it together, so it's really been a team project between Stephanie, Jamie and Mark.
Sounds good. We'll get the bleachers in for what will be our biggest attended meeting ever.
I thought the parking lot, I was like, yeah. That's where I know.
I know, that's what I thought too. What is going on here today?
Any other questions about the administrator's report? Thank you so much. We'll go on to our main event, number 6, discussion of the Parkview Health Center budget. County Executive.
Yeah, first of all, I just wanna, give a credit to the Parkview team. I think, Lindsay and Doug, have been 2 sets of fresh eyes that kind of came in and take a look at how to do things. Making sure that, we're accounting for revenues the best we can. There's been a few things that have gone their way as far as Medicaid reimbursements, and some other things with the state formulas. But that's not entirely it. A lot of it is both of them really working in tandem to kind of rethink how we're doing things. So they brought me a really decent budget. In the executive session, we offered no real changes, other than there was a request to up some of those revenues because the Medicaid reimbursement and some of the state reimbursements from DHS have been better than we think. We did still leave the $2 million of wage turnover savings in there. Because I don't know how effective recruiting will be. I'm hoping that we will have to come back for a budget transfer for labor. Because we filled positions.
And if we fill positions, we'll fill
Revenue,
so.
right.
It
Yeah.
will offset.
So be easy, but we would still need the authority to spend that. So that is my hopes. They'll become for a transfer on the labor line. Other than that, I was much more worried about Parkview in the last 2 years than I was this year. Budget's pretty well straightforward. And this is one of the easy ones. So if you got questions for me, the one thing I do want to say as far as budget overall. In the overall budget, we have $4.6 million of fund use balance to kind of balance it out. In history, I know that's shocking to a lot of people, but in recent years, we have used 8. Going back to, I think, 2019, we have used 8 because we've always had fund balance that goes up. So even in that 4.6, we do have $1 million of fund balance applied from the Parkview fund, which I don't think we will touch again. So one of the conversations we've been having with some supervisors, with this will be, they've gone through fewer budgets. Just because you budget dollars does not mean you're going to spend dollars. So this is the maximum amount that we think that we would need for 2024. It does not mean we are going to spend all of this in 2024.
Right, go ahead.
Okay. Parkview is always the savior in some way. It's either 3 million or this time it's gonna be 1 million. So it's an enterprise. We have 3 other enterprises. My question is the one enterprise that we know that has a big pot, why don't we ever think of changing that ordinance for that enterprise? Okay, but
that is a further
that's a
statutorial and constitutional discussion I would love to have.
yeah, but we can change things. Okay, so on the PTO, so I'm going to bring it into here because Parkview has done as much, if not more, to incentivize their employees. We have struggled. We have changed things up. We have done wage raises, which needed to be done. We have given all sorts of, we have done beyond where you normally would go. So we were into that portion of it. Do I feel that the PTO will have a flock of people lining up to be CNAs? I don't really think so. And the reason I don't think so is who wants to be a CNA? It's a step to being an RN, I will tell you that. But the young people now are looking at I don't do that. So I'm not sure that we'll see that. I hope we do, that it brings people in and they go, look what I get. But when I pointed that out the other night, if I come to work on January 1st and you give me 25 days and I got that in my mind, January 1st of next year, I leave. I'll get paid out that because I've done the year. So keep that in the back burner. I think what brings people here more than anything else is word of mouth about the facility and what a great place it is. And it's a good place to work. And I guess I was kind of amazed that we only had 7 paid holidays out and not 10 like the rest. That's a good thing that that's coming this way. It's a very good thing. So we'll see where that goes, but the reputation of the place is excellent. I just think the owner wants to be what out there is a real job. Don't think that everything is going to be resolved by that situation. Out here in county wise, is the government a good place to work? You betcha. You betcha. So I'm hoping, you guys, I'm hoping this all works and Parkview benefits.
I'm confident it will.
Based on what?
Based on 3 things. Number one, when we interviewed for the administrator position, my main focus was culture. And Lindsay hit all my marks on culture. It's gonna take her time, and she's doing a great job out there. And making sure that we have more communication, that we bring staff in when we make decisions, we give them input. So based on that, number one, based on 2, it's a little bit of that. We have to do a better job of telling our story. It's telling what our care ratios are. It means more than that. And if we can actually attract that and build that culture to bring people in, you might actually be able to take a weekend off. Just had a baby at Bell and Health in Green Bay. They haven't had a contracted nurse in their doors in 6 months because of culture. Right? Not a single contracted nurse has come in their hospital in the last 6 months because of the culture they've built. So these nurses, because the industry is struggling right now, so we can build a safe haven for those that understand that they're gonna come into a good team that has a good PTO. We're not gonna, we hopefully won't, the other thing we won't need is the $745,000 we have budgeted for overtime. So if we build that, and I have faith in Lindsay that she's the person to lead that charge. That's why you're going through a PDA leadership course, right?
Oh, I already did.
Right, that you did. That was a lot of time. It was a 12-week course.
Yeah.
Right, to teach you kind of how to listen, how to get that input, and how to build that culture. And I know I asked a lot of you to go through a 12-week course. But did you get good
Yeah,
stuff
it
out of
was
it?
good.
Right,
was
and
really
you're
good.
starting to implement things a little bit better, and people are starting to buy in.
Yeah,
Yeah, and
I
we're
mean, yeah,
right,
yesterday's move just showed it.
right. So I think that culture's coming around, and I wouldn't be surprised if people don't start flocking to this facility when that word starts getting out within the year.
If I could just interject
Please.
and augment. So, wouldn't we see more tendency to have lateral movement for already existing trained employees with the PTO change, and you wouldn't necessarily have an impact new CNA staff coming in?
But, you know, I think horse piece like that. I don't think 25 days of PTO is too common and competitive.
Yeah, so, okay.
I want to say something about the 25 days. In the first place, 25 days are given to add to your time off. But it is required that you schedule that time according to the rules of the scheduler and the administration, okay? You can't just say, I got 25 days, I'm gonna take whatever I want. Okay, so it's a nice gift at the beginning. But every one of the new employees, when they come, they're gonna end up understanding also, you know, the give and take that goes along with it, okay? So it's not something that's just given and brought out there.
I understand that, but you are going from what do you have now, 7?
Well,
Seven.
First year?
It's 7 holidays.
7 holidays.
You don't have anything but the 7 holidays that you would normally have,
Yeah.
you were starting with.
It's all different at Parkview.
Okay.
And
25
It's
is
all
significant.
different at
and it's
Parkview.
different within Parkview.
Yeah, it's all different at Parkview depending on what position you have.
Okay, but
Yes.
is it fair to say that the 25 is a significant increase over what you had before, even though you have to
Follow the rules.
follow rules?
Depends on who you are.
Very
Well,
good. Very good.
They're gonna go from like somewhere between 17 and 19 to 25, but they're gonna be accounted for. Right, like not all of those 17 or 18, whatever they have today is necessarily available, right? Like not everybody has an opportunity to use bereavement leave
Right,
in a given year. But now that's converted into a generic PTO, so that's why, I mean, in addition to all the things you're saying, that's why it's kind of complicated, in my opinion, to say, you're going from this to that in a direct linear way. It's more of a
Yeah,
kind of a range.
it really all depends. Some people at Parkview get 4 floating holidays. Some people at Parkview get 7 floating holidays. Depending on who passes, you could get 3 days of bereavement, you could get 1 day of bereavement. So it really,
It's different if you're a cook, it's different if you're a housekeeper, it's different if you're a nurse.
And it's really different if you don't work for the government.
Yeah.
Not, and in private places, it's all different.
Mhm.
Not everybody working at this small business
Mhm.
or this big corporation
Mhm.
has, it's all different.
Right.
So that's why I say working for the county can be a very good job,
That's right.
or any government.
But we also need the best of the best.
But
got a hard job to do.
out here especially, we need very qualified people.
Right,
Taking care of the frail and the elderly.
right.
I know that doesn't really answer your question,
no,
but,
it does,
okay,
and we'll go over this more
it really varies and yeah,
We'll go
next
to
month
store.
we can go over it.
next month.
Yep.
So,
Well, and by next month, they have to have the resolution, written up for P and F to be passed in November to go to the county board, so I think, Mark and Stephanie and Jamie are working hard on that and still working with Parkview and some others.
Yeah, I mean, I'm sure there's things that are happening behind the scenes. I don't know about
Yeah.
it, so I'm not really,
Well,
you know,
We've
I'm
got a lot
not the
of
greatest
feedback,
person
yeah.
to talk
it
about
would be
that
nice
either.
to have Mark, you know, come in with, you know,
Yep,
and sit down and explain the ins and outs a little bit, even before we get to that point of solution. So,
back to the budget. Yeah.
Yes.
Other budget questions? Like you said, I have, but I want to give everybody a fair shot for. Okay.
Was that satire?
We'll see how long this takes. No. Okay, so I just had, first I want to say on, when I'm looking at the budget on page, 346, ultimately the 2023 projected net levy is you know, it's your net, 6.2 million on the levy. But I just wanted to sort of tease that out a little bit, maybe hope that we could, like, during the presentation at the board, that we could just sort of note. Because I think that number includes the 8 million ARPA, the 8 million and change ARPA transfer out. And so if we're thinking of, if we look at this line, of course, there isn't a $6 million levy hit on Parkview. And what it really should show is what we had just talked about earlier. So I understand, of course, why the budget book is printed this way, and that's a true accounting. But I just would appreciate if we could just mention that, because I think it's a very big, should tell us a very big difference in the story.
so it's really more like $1 million rather than, right?
And in the other direction, like a positive.
Good.
the net levy is 967 494, I believe.
Yeah.
Going back page.
Yeah.
Well, I think as we just discussed, the net levy will actually end up being around 700,000.
Right.
Based on the trajectory we're on.
Correct.
It's obviously still a projected number, but I just thought, it'd be good.
Sure.
Since that's a big difference from obviously years past, so, okay. What is it, what's the number of daily residents that we use, to figure?
This budget was prepared on 121, I believe.
Okay. So that'd be opening,
One more,
then we're
yeah.
gonna open a whole other meeting.
Mhm.
Yeah.
Get a big jump in.
Yeah.
In staff. Does the budget make an assumption about the staffing number independent of the residents, or is that directly tied to the number of residents?
It will be tied to the rest.
Okay. You have a ballpark for what we built the budget around and what our deficit is now, like we have to hire like 4 more RNs and like 12 more CNAs or something,
To
to
open another,
get to the number that we budgeted.
yeah, I think. Yeah, what did we figure it was? 6 nurses and what, 14 CNAs.
What are there, 21 residents?
Mhm.
Okay.
Are there other, besides PPO, I don't want to open, we don't need to talk more about that, but are there other policies that we're looking at to help hire more people?
Getting more involved, I think some of the extra staff that we've had in the HR is allowing us to start to go to job fair. The Oshkosh Chamber event at the convention center this year, normally we would just airport would rent the booth. We're trying to expand that so we can have a whole county presence out there and kind of get out more. So yeah, we do have some plans to have some more free time to get out and actually try to recruit some people. And know that Lindsay doesn't have a 12-week class to go through. Free up some time too.
But we do job fairs. Our staff, our CNA coordinator, and our education coordinator, they both go out to job fairs at UW Oshkosh. They'll do mock interviews with the health students there. We also just signed a contract with a college, so they will do, it's an online college, but they need a site to do clinicals. So we are now going to be one of their sites for their nursing students to do clinicals. So we're hoping that maybe we can gain some more nurses that way. But then in turn, they also gave our staff members discounts so that anybody wants to increase, their knowledge. So if they want to get a master's in social work, they could get a discount there. If they want to go for their bachelor's or their master's in nursing, they could go there for a discount. So it's, we partnered with Chamberlain College, which is pretty, it's pretty known college for healthcare. So that's a benefit for us as well too, and for any staff that work with us.
Okay, so I think if we're trying to increase our staff by this much, about 20%, we should have something behind that and not just have it be sort of a thing we say we're gonna do. And so I'll ask again at the budget to talk about, some of those things, but I know last year we talked about, there's all these industry standards for nursing homes that we're not meeting, like we're not as quick at hiring from the time of the interview as other places. We don't do some other places will interview and make a contingent offer on the spot, and we're still kind of delayed in that. So I think if we're gonna approve a budget that calls for hiring all these additional people, that's been a focus that we've looked at the last year. We haven't seen we haven't seen, I think we've stemmed, stemmed the bleeding, so to speak. But we haven't really turned the tide and started to put numbers on the board, to reduce, the vacancies. It'd be nice to hear a little bit more about how we think we're gonna, go out and start hiring 10 more people a month or whatever it would take to get to the staffing number. I think it's a combination, yeah, but I'll let you in a second, but I just want to say, like, I don't think that's all you, right? It's like, right. That's, some of that is policy on the HR side, some of it is logistics, some of it is, lots of other things, but I think just, all around, I think that's one thing that is crucial to whether we're gonna hit that 121 resident number, whether we get the waiting, list down or whether we're, yeah.
I would say multiple things have happened, that are exactly what you're asking for. The reslotting fixed our compression and opened up our hiring range for us to actually make some decent offers. With the CNA training course too, I think that's helping out. The change to our merit pay system is, people, I think, are gonna like that a little bit more, so that's gonna help the culture. The PTO is definitely gonna help, if that gets passed. The transition to be able to do the year analysis on prem is making that faster. Huge faster, so that's already been done. And I'm really close to being able to have online applications. We are working on it. I know that is something that Mark is working on heavily to make sure that Indeed applications actually transfer to our application process. Right now, it's not. And with the extra personnel they have, it's kind of freeing them up from the things that were holding in the weeds. They are improving. So I think it's a great question, and I think there's some legitimate answers to that question of things that we could say we've been doing.
Great, I'm gonna ask that again. I want everybody to hear, some of these things. I think this is one of those tough nuts to crack where it never actually gets solved, right? Like, hiring is always gonna be a huge component of what we do here because of the volume of staff and everything else. And certainly for the moment, everything else cascades from, can we hire enough people? And those things you talked about, I think help keep people in many cases. Sometimes it might help on the attraction side. Working on both of those at the same time, I think are, goals for stability here.
Yeah, I think as far as increase goes, I feel like when I started here, it was taking about a month to get people in. But we have really, I feel at Parkview, I know the numbers don't speak for it, but as far as getting somebody in the building now, being able to do the drug screenings in-house, the TBs in-house, versus them going out to Ock Health. I mean, that's helped tremendously. We're talking 2 weeks on top of saving the county money. And then also we started doing our own reference checks on site. So whoever's interviewing, they're doing the reference checks. We're not waiting for somebody else to do the reference checks. And then we started doing our onboard paperwork on site too. If they have to do any benefit information, then they can go downtown and they can meet with an HR person, but otherwise we're taking it all more in-house to get it done faster.
The biggest complaint in this county right now for people applying for jobs is what takes so long for me. If I really want this job, why am I waiting? I've done 3 other interviews somewhere else, and I'm not saying it's public, private, whatever. They get called by that other entity, they're gone. So it's a tough nut to crack, okay? But all my time on the board, it's the biggest complaint.
It's getting better. When I first got here, every job offer, every interview, and every reference background check, everyone for every department had to go through HR. We did
So
not.
what she's doing right now.
We wanted
to me a great step forward.
Right, and we need to be able to trust them to be able to do that
Right.
process, and it's the direction it's been given, the direction we're heading.
Yeah.
Is this happening in all the different departments?
Our larger departments, so
Like park and rec, or like,
not so much the park and rec, but
Human
human services. In some of our larger departments.
that's important to, to gathering future employees.
Well, there,
Gathering people and letting them all know, getting the word out to to have a common experience in all facets of the county.
well, and there's training involved. You have to know what questions you cannot ask in an interview.
Right.
You can't just sit down at a table and have a conversation. There are trainings involved, especially when it comes from a government organization. We have to know what is being asked, and they're asked to. So it's not just as easy as once you sit down and hire and interview a janitor today or a custodian. You have to know what's out of bounds, what's in bounds. But we are getting much better at that.
Okay, I think I have two more questions. I think maybe Doug, you might have to help me out with this.
Okay.
I think last year, we had like a fire door in the budget that then didn't need to be done.
The fire door was in our, for our loading dock. And the actual, they didn't have to replace the frame, just the actual doors themselves, so that actually has been done. It now works properly like it's supposed to, and they have magnets on, and if a fire alarm goes off, magnets release and the door closes. So that's all taken care of, and that is already in our repairs.
Perfect, okay. And then, I wanted to ask, last year at the, one of the requests was a tuition reimbursement program. And you were working on a broader, maybe countywide program. Wanted to try to get an update on that.
And we're, of course, still looking at it, workforce development. As soon as people started finding out about their grant program, they went through their money pretty quick. The other concern on that was we wanted to see if that was a possibility, but if you do it through that, that's the employee goes and does it with workforce development. We can't guarantee that they stay within parking for a year or 2 years. So I think one of the things that we're looking at is what Lindsay kind of talked about, this contract that we have with is it Cumberland? Chamberlain. I always get Cumberland stuck in my head, so Chamberlain. To see if that works. Is the discount enough? Is this a way for us to work with them, not only to get our people that want to move up trained at a discount, but also that collaboration with Chamberlain for their nurses to come here and do their clinicals, I guess. Is that the right word? Yeah,
Yep.
here, hopefully fall in love with our environment and our facilities and then want to stay here. So that's kind of where we're at. We're gonna see how this goes before we pursue further.
Okay. Well, my questions. And then how we okay. All right, if there's no other questions, move on to self-pay. At 7, increase 2024 self-pay. I don't know if you have something to say on this one too.
No, if I may be excused, is that all right?
Go
Go
ahead.
for it.
All right, thank you all very much.
Thank you.
And again, if anybody has further questions or something comes up, please feel free to reach out.
Okay, so we are asking the committee here, our current self-pay rate is $330, which is the average rate for 2023 before the 4 different county skilled nursing centers that we were able to get numbers from. We would like to increase this to $350, which would be
It's 335 currently.
oh, it's
Yeah,
5 a month for 30 days.
oops,
335.
335, sorry.
If you go to 350, then it's a 30-day fee is 10,500.
Oh.
Yeah.
So we'd like to increase it to $350 for 2024.
4.5%.
This has nothing to do with trying to get more revenue in here, it's just to keep us on an even keel with light versus light,
Yes.
like safety.
So, we did reach out to, 4 of them that responded to us. Amro, Care is at 298. Edenbrook is at 298. Bethel is at 336. And Evergreen is at 406 currently.
Okay.
None of them have
Nothing.
finalized the 24 rates yet.
406. Bethel 336.
Yeah.
Eden 298. What was the first?
290.
Yeah, they're both the same company.
And they're staying that way?
Well, they have stayed that way probably
That's
for 5 years now.
Okay, that's existing.
It's existing.
How long are you planning on keeping this?
Well, we always reviewed it once a year.
Yeah, we reviewed it.
Annually,
Annually.
annual increase.
But, I mean, we don't,
But
We
based
went-
on,
we wouldn't normally go up
When is this
a
used?
bunch.
When is this
This,
self-pay rate used?
any,
At what point do you?
any persons that are paying privately. So they're not paying through Medicare, Medicaid, family care, insurance,
paying them,
private
paying
pay,
themselves.
paying privately,
So whatever on the,
That's the street rate.
street rates, yeah.
okay,
So what would you call it if it was a hotel?
so we had 20 private
That's
pays
our room rates,
in September.
our daily room rates,
Daily.
all inclusive,
And then they become one of these.
Pretty much.
yeah, pretty much, 3 meals a day.
But this is an
snacks,
annual thing that we've been doing on here,
Better
activities, bingo.
and
Yeah.
nobody likes raise.
than. So, excuse me.
Yeah, go ahead.
Before, how did you determine 4.57? Well, more than, maybe more than that, but. So if it's 330 to,
335.
but if it was 330. The I don't know, get into hypotheticals here, but you had a 6% projected, now you're going down to 4.5. Are you gonna stay at the 6 and go up a little higher now that you know that it's 335 or
No,
No,
it's stay at the 350.
stay at 350?
What was the old rate?
335.
How did you determine how much to increase the rate at?
Well, I asked Doug. And then I wanted to increase it more, but
CPI, CPI,
Based on the inflation rate
based on inflation, yeah.
of projected.
It's one of the higher percentages that
Yeah.
that I've seen before me while I'm on this committee.
The last year, we went from 300 or 305 to 335.
But the whole atmosphere of,
that's 983 last year. That's
Yeah.
Mhm.
You're not using CPI to do the increase.
No, that one we hadn't raised for 2 years.
Okay.
So we wanted to do kind of a catch up because we knew we were.
Do you know what the CPI is right now? I don't even know exactly what it is, and even what they tell us, I'm not sure that's really what it is, but. You know.
But just based on, how much medical. Supplies have gone up.
Okay.
And food costs have gone up. And figured we'd have to go at least close to them.
Feels like the sectors, at least the broad sectors that comprise the aggregate CPI are the ones that have been hit the hardest, for the ones that they exclusively deal with.
Thanks. I interrupted you, I'm sorry.
No, that's all good. I was just gonna say, yeah, it's one of those things in the county that we need that we budget for. Or the budget at least includes an assumption on these things, and then different departments have them different ways. This one we approve by, by ordinance or whatever. Every year, the airport has some automatic things in the ordinance that increases, so,
Our rent out there and stuff is big. Yearly increases with the
Yeah.
CPI.
yeah, so not an abnormal thing, or any, anything like that to have a rate increase combined. I got a question on if you're gonna bother me, that comes out to about 125 a week. For these individuals.
It's 350, going to 350 a day.
Yeah,
I don't know what the financials are of people that are private pay. But is it, it seems like an awful lot.
It is,
it sure is.
it is, but there are no other options at some point in people's lives.
I know.
There's something else.
At the home, and I know what we
They-
pay.
They
So
go
we
through
ran
their assets, they go through their assets,
Yeah.
which is sad, it's sad. But if they come out here, they get really good care.
And you have to remember it's 24 hours here. And it
Okay,
costs a
now
lot
somebody
to
is-
take care of somebody 24 hours a day.
They've exhausted their personal finance. They don't, or do they get moved on to someplace else? You know what I'm saying? Because some places wanna become,
No,
this is a county place, but some wanna become all private.
no, if they are close to exhausting their private funds, then we would fill out the necessary paperwork for them to apply for medical assistance.
Right, but if you have a waiting list on long-term care, can they necessarily get in here? After they've exhausted their private fund,
If they're here, they'll stay.
so do they have a better avenue to be able to stay than the people who are on Medicaid who are in here? Moving to long-term care?
It's a good way of putting it.
Yeah, I guess if they're here and they're private pay. If they switch to a different pay source, they still
They
stay.
say,
What about the people who are on Medicaid to start with when they come in here temporarily and then
doesn't matter.
doesn't matter?
Nobody gets cost.
Yeah, no, I think that's the answer.
Nobody-
At the end of the day,
Doesn't
that's
matter.
what I'm asking. Nobody
I'm asking.
can show the door.
Doesn't matter.
Right.
But the fact that we don't have the wing open and the staff, that is
That is the
a
concern,
roadblock.
Yes.
yeah.
To be having people care. Do you make every provision to try to find them alternative place to go if you can't take them in long term?
No,
No.
No,
if they're not under our roof,
yeah,
no.
No.
If they are under our roof, under purview, they are our responsibility.
but if they come in like on short-term Medicare rehab. And they go to Medicaid during that time period.
Sure.
You may still not have a place for them long term, just like the private pay, you may not have a place for them long term, right?
That's fine, they'll stay with us until we can find a place
You,
that,
well, that's what I'm asking, you go
Yes.
out and try to find them an alternative place.
we will try to
go.
find alternative if they require, less
Yeah.
care. Yeah, so if they could go to an assisted living, we're gonna try to find them an assisted living for them to go. If they could go home, we're gonna make arrangements for them to be able to go home, regardless of payer source.
Right, that.
It is
There is
our
no-
responsibility to make sure if they need to leave our building, that they have a safe
Safe.
discharge plan,
Yeah.
no matter where they're.
Yeah, I understand all that because I went through it. Okay,
Yeah, it doesn't matter, same with the wait list. It's a first come, first serve on the wait list, it
yeah,
doesn't matter.
okay, yeah. So
Doesn't,
there's no
just
preference.
because you're private
There's no
pay doesn't mean
preference
you
here.
move up the list.
Correct.
No, that's not
Okay.
how it goes.
Okay, thanks,
Yeah.
I'm getting off topic here.
Mhm.
Just another quick one on that. Both my parents ended up in nursing. Private pay. What does a private pay now? Or right here in front of you?
335.
35
35.
That's a day.
per day.
Mhm.
What was that?
9,000.
Yeah, we need to go something for a
Well, we're
month.
going to 10.5.
That's what I thought I came up over 10,000.
330 for, how long do you want, a week
A
or a
30
month?
day.
Well,
30
I think
days.
it's got other-
You're looking at about 10,000.
$10,050.
Why would somebody, I may be off on this, I think
time my dad was, harbor review, I think at that time we paid just under 3,000, of course, that's 10 years ago. So, you know, what I'm saying is, why would I elect private pay more at Parkview than at some other place?
Because of what this place offers.
So,
Quality,
well, right now,
But nobody-
the places that we check, like Amro Care,
Yeah.
that's 300 a month.
I made a mistake.
So that's
I gotta
9,000.
withdraw. I gotta withdraw what I'm saying. My father was in, can't even think of the right name for it now. Assisted living.
Oh,
Somebody mentioned assisted living, that's where I got the mistake.
Yeah.
okay,
That is cheaper.
Yeah, that's why I said, why would somebody come here to assisted? living?
sometimes, sometimes it's cheaper.
You're-
Sometimes it's cheaper, depends what their,
No matter-
depend what services you need and what a la carte you're adding. It might be
Very good.
just as expensive as
You want
skilled
this, you want
nursing.
this, and. yeah.
Yes,
But in the long run, just so everybody realizes, when you get older, you were independent, took care of yourself, right? And then things happen in your life and it's a step. And you know the nursing home is probably the best step.
Mhm.
So you try to avoid that step as long as you can by doing, and it'll happen to everybody. I want to stay home, I want to get help in the home, I want to try assisted living because then I still have some of my independent, but your health determines where you need to go. So there's nothing in between assisted living and a nursing home.
No.
No, there just isn't, and I don't know if there ever will be, so. Is an expense, yes, but you need to be safe, and so that's what happens. Because the family just can't do it all, whether you think or not, you can't, but you try.
So the rate you're at, the rate you're going to, you're still within the range of the 4 competitive nursing homes
Mhm.
you've given us here. And, that's even under their existing rate structure, they may be contemplating increases too, so.
Yeah.
It sounds like you're still in the middle of the range for a very nice facility.
Yep.
And, you know, that's a good thing.
Do we need to vote this?
Yes,
Do we need a motion?
That's what I should put down. Oh, no,
Yeah.
Can we do a motion?
please.
Okay, I'll make a motion to increase Parkview's self-pay rate for 2024 to $350 per day. Is that first?
Now we have a motion and a second. Any further discussion? Okay. Just note that the agenda item report will just make sure that the current rate is adjusted for the actual resolution or ordinance or whatever we need. All right, any other questions? All right, all in favor, say aye.
Aye.
Opposed, say nay. Carries. All right, number 8, suggested topics for a future meeting. We have a deeper dive into PTO. Any other items folks want to add to the list?
But we don't need the whole presentation again. The PTO presentation.
Right, maybe just any substantial changes and then,
Or-
how is it affecting
Here,
Parkview?
right, right.
Yes.
As well as maybe how, is there any feedback from on the street as to how, and now that it's out there, we had the presentation at the board, is there any feedback on the street that people are hearing of the public's reception of it?
Perfect. All right, anything else? Okay,
so suggested topics is the PTO plan
yes.
Basically,
or Parkview, related to Parkview.
how it affects,
Right.
PTO review or up to.
Okay,
not a whole presentation. It was done well the other night. Okay.
I would think that Parkview is gonna differ than the highway department and all these other places.
Be a lot more else, yeah. All right, our next meeting will be November 16th, at 3:30.
Okay.
Work folks, same time, same place.
actually, we're gonna be in the volunteer room for November.
Okay.
These rooms are booked, so, yeah, just right down the hall.
Okay.
Sounds good. we'll all be cozy then with our expanded finance or HR. All right, then we're on to adjournment.
So moved.
Second, all in favor? Aye.
Aye.
We are adjourned. Thanks, everybody.